bit of a treat right now. We're going to get some actual expert analysis for once on this show. We welcome to the show from Rothman, Dr. Shyam Brahmabhatt, as we try to figure out what could be ahead for Brandon Graham. Doctor, thank you for joining us.
Thanks for having me, guys. Can you hear me okay?
Yes, we can.
Perfect.
So Brandon Graham tore his triceps. I said pec earlier. I meant triceps. Tore his triceps basically exactly 2 months ago, November 24th. How realistic is it to think that he could be playing in a football game in 2 weeks?
So, I think when you talk about us normal humans, I'd say the answer is no.
Okay.
But when we talk about superhumans, I just looked up J.J. Watt had surgery for a shoulder, and in 10 weeks he was playing for a playoff game. Right. So you would never think of that. If you came into my office with a triceps tear, I'd say, hey, 6 months is a good number for you to play NFL football. But these guys are huge human beings, and I think they can accommodate a lot better than you and I can. Now, that being said, I'm not his team doctor. I do not have access to him. I don't get to examine him. I don't get to see his MRI, things like that. And if you have had surgery, the answer is, most people would say 4 months plus, but he's looking at 2.5 months. But I think these guys are very strong. Also what you could do is triceps. So for people listening to you, what do you need your triceps for? Push-ups. You cannot do your push-ups without triceps. You're trying to push people off, right? So alignment is that's what he's going to do. But you could put him in a brace, have him in a certain extension lock that he won't go completely incorporating all his triceps, and people would be okay. A lot of people, Suggs, he was a D lineman for the Ravens.
Yep.
He played with a torn triceps for a long time. In fact, the entire season, and then had surgery at the end of the season. So I think you can get away with it. Yes, you want to make sure you don't have a re-injury.
So after the point of surgery, what's that process like with the rehab to get it to a point where he can at least comfortably play? Like, does the muscle atrophy in such a way that you're not going to have the strength that you would expect of an NFL player?
Wonderful question. So, first things first, right? With any surgery, you try to say, hey, let's get your range of motion first. So if you have full range of motion, then you say, let's work on strengthening. Because at the end of the day, you're repaired to bone. The triceps, when it comes off the bone, it gets reattached with drill holes in the bone, with anchors, with suture material. You want the tendon to heal to bone before you stress your repair. But I'm sure they have done a repeat MRI to see, hey, if the healing has taken place. They look at his range of motion, and then they evaluate the strength. More importantly, for a player, we say, hey, you need to be able to protect yourself before you get on the field. So if somebody's coming at his face, he needs to get his arm up there and protect himself.
It's interesting because for Brandon Graham, obviously, this is a bit of a different calculation. Like this could be the end of his career. And so we talk about the risk for re-injury. I don't want to be craven here, but it might be less of a concern for him because he's not then thinking about getting back for next season. Like the risk might be worth the potential reward.
It's hard for me to make that decision for him, but
sure.
We wouldn't have the Super Bowl without his strip sack, right? I mean,
Exactly.
and just having him on the field is very helpful. But that's where a team doctor pulls out of that, fan mentality and says, what do I need to do for my patient/athlete?
If I could follow up on a previous question or a previous answer, I should say, what would he wear during a game to still have the range of motion that's needed, but protected in such a way that won't be problematic?
So there are certain braces that will give you a lock, guys, so that it won't let you extend all the way, right? Okay. So if there's a lock, then you say, hey, you're incorporating some triceps, but not all of it, so possibly reduce the chance of re-injury. So I don't know if you guys watched last night's game. After our game, there was a Buffalo Bill guy. His strap kept coming off. A brace similar to that will prevent from re-injuring the triceps repair.
Interesting. And now it's his left. So I'm trying to think of, like, if he's picking which side to rush from, would you want it on the inside arm or the outside arm?
I would ask the doctor.
I don't know how much defensive line background you have, doctor, but I guess
that's why I do what I do for a living, guys. So
how
I think,
often do you have?
anyways,
I'm sorry.
I think so even going back to the Buffalo Bills game, there was a guy who had a concussion, right? He started with a B, his last name, and he had a massive concussion yesterday. He was having trouble standing. And so football is such a collision sport. Anything can happen. So you put him on the left side or the right side. If he's ready, then he's ready.
And it's also, what I think what Brandon Graham has said publicly, and I expect him to make some kind of announcement today, is that like his rehab so far has gone well enough that it's been encouraging for the likelihood. What would that rehab be like for him?
So I think you got to have full range of motion and to me, say, if I saw you guys in the office, your strength ought to be 90% of the opposite side, the good side. When that happens, you're good to go. But remember, like Aaron Rodgers, there was a huge talk about him coming back from an Achilles tendon rupture, like 2 months, 3 months after injury, but never did come back, right? And he even struggled this year. So as we get older, as we get older, it starts taking a little bit longer. But JJ Watt, on the other hand, is a big boy. So he has so many muscles. Brandon Graham is such a big boy. They have so many more muscles to help them accommodate for any lack of strength that they have with a specific muscle group.
I feel smarter.
Yeah. I feel in awe of these players who are playing with an injury that should last that long, playing in a game.
Well, I also feel in awe of someone who has an actually
you and I
important
wouldn't
job.
even think about it. Yeah, you and I wouldn't even think about it. But these guys, they have a passion. I think they're phenomenal, like species. Like they are at a such higher level than we are. I think cannot apply my protocol to them because they're at a different level.
That's well said. Well, doctor, thank you so much, Dr. Shyam Brahmabhatt.
Have a wonderful day, guys.
Thank you so much for having me on.
Appreciate it. Bye-bye.
That was great. I feel so much smarter. That was great. Thank you to Rothman.